Welcome to 5-Minute Health Tips. In today's video, you will learn the symptoms, causes and treatment of erectile dysfunction. This video is for educational purposes only and does not replace a medical professional's advice. This video will be longer than usual. Please stay with us through the end. Erectile dysfunction, ED, is the inability to get or keep an erection firm enough to have sexual intercourse. It's sometimes referred to as impotence, but this term is now used less often. ED may be occasional or frequent. Occasional ED isn't uncommon. Many people experience it during times of stress or as the result of a recent nutritional or lifestyle change. Frequent ED, however, can be a sign of health problems that need treatment. It can also be a symptom of emotional or relationship difficulties that you may want to address with a professional. How common is ED? According to the National Institute of Diabetes and Digestive and Kidney Diseases, around 30 million US men have ED. The prevalence of ED increases with age. The University of Wisconsin estimates that mild or moderate ED affects 10% more men for each decade of life. For example, 60% of men in their 60s might experience some form of ED. However, ED can also occur among younger people. One 2013 study found that 1 in 4 men seeking their first treatment for ED was under 40 years old. Although the risk of ED increases with age, ED isn't inevitable. In general, the healthier you are, the better your sexual function. Erectile dysfunction causes. There are many possible causes of ED, and they can include both emotional and physical conditions. Common physical causes include cardiovascular disease, diabetes, hypertension or high blood pressure, high cholesterol, hypothyroidism, obesity, low testosterone levels or other hormone imbalances, kidney disease, increased age, relationship problems, certain prescription medications, such as those used to treat high blood pressure or depression, sleep disorders, drug use, consuming too much alcohol, liver cirrhosis, epilepsy, using tobacco products, Parkinson's disease, multiple sclerosis, MS, damage to the pelvic area through injury or surgery, Peyronie's disease, which causes scar tissue to develop in the penis. Common emotional causes include stress, anxiety, depression, performance anxiety, relationship problems. ED can be caused by only one of these factors or by several of them. That's why it's important to work with your doctor so that they can rule out or treat any underlying medical conditions. Erectile dysfunction symptoms. Trouble getting an erection and difficulty maintaining an erection during sexual activities are the most common symptoms of erectile dysfunction. Other sexual disorders related to ED include premature ejaculation, delayed ejaculation, anorgasmia, or the inability to achieve orgasm after ample stimulation. Speak with your doctor if you have any of these symptoms, especially if they've lasted for 3 or more months. They can help determine whether your symptoms are caused by an underlying condition that requires treatment. Erectile dysfunction diagnosis. Testing for ED can involve a variety of steps, including a physical examination and examining your health and sexual history. Your doctor may order additional tests to determine if your symptoms are caused by an underlying condition. Physical exam. Expect a physical exam, where your doctor will listen to your heart and lungs, check your blood pressure, examine your testicles and penis, looks for signs of reduced blood in the pelvic region, check nerve function in the pelvic region. They may also recommend a rectal exam to check your prostate. Psychosocial history. Your doctor will ask you questions or request that you fill out a questionnaire about your symptoms, health history, and sexual history. The responses can help them evaluate the severity of your ED. Some questions that they may ask include: how long have you been experiencing ED? Did it come on suddenly or gradually? Are you having any problems with feeling sexual desire, ejaculating, or reaching orgasm? How often do you have sex? Has this frequency changed recently? How firm are your erections? Is this affected by particular situations or types of stimulation? Do you wake up in the morning or in the middle of the night with erections? How's your current relationship? What expectations do you and your partner have for each other? Have there been any changes? Have you recently been experiencing a lot of stress? What medications are you currently taking? Do you use tobacco, alcohol, or non-prescription drugs? Do you have any underlying conditions or have you had any surgery on or injury to your pelvic area? Medications. Your doctor may prescribe medication to help you manage the symptoms of ED. You may need to try several medications before you find one that works. The following oral medications stimulate blood flow to your penis to help treat ED: Avanafil, Stendra, Sildenafil, Viagra, Tadalafil, Cialis, Vardenafil, Levitra, Staxon. Alprostadil, Cavaject, Edex, Muse is another medication that can be used to treat ED. It can be administered in two ways, as a penile suppository, or as a self-injection at the base or side of the penis. Talk therapy. A number of psychological factors can cause ED, including stress, anxiety, post-traumatic stress disorder, PTSD, depression, vacuum pumps. This treatment uses the creation of a vacuum to stimulate an erection. Using the device draws blood into the penis, leading to an erection. A vacuum pump device consists of a few different components. A plastic tube, which you place over your penis. A pump, which works to create the vacuum by drawing air out of the plastic tube. An elastic ring, which you'll move to the base of your penis as you remove the plastic tube. The elastic ring functions to maintain the erection, holding the blood in the penis and preventing it from returning to circulation. You can leave it in place for 30 minutes. In many cases, you can improve your ED symptoms. Many medications and treatments are available. Certain devices, such as vacuum pumps, can also help you temporarily manage your symptoms so that you can continue to engage in sexual intercourse. If you like this video, please like, subscribe and hit the bell for us, so you'll get notifications for our future uploads. All the best, from the 5-Minute Health Tips team.